Well, welcome everybody to our monthly lovely virtual meeting and webinar tonight, or today, I should say. We're doing Dry Eye Awareness Month, which is the whole month of July. And of course, that's our favorite thing to talk about here at Foley Vision Center. We're happy to have you here. We're thrilled, and hopefully some of these things will just be great review for some of you, and some of it might be kind of new. We're going to talk about some of the newest things that are happening in the dry eye space and the ocular surface disease, all of these wonderful meetings that I go to. I think I've been to 15 so far this year. So we're learning lots and hope to share some of these good new things. We're also going to be doing a treatment live on our lovely Gabby, our advanced laser esthetician.
My favorite part is getting to lay down for this.
And you guys will get to see up close and personal what a BlephX treatment can do, which does a beautiful job of clearing debris from the lid lash area, which is, most of you know, I start from the outside and I work my way in. So important to keep lid hygiene as one of our top foundational treatments here at Foley Vision Center, but it is really important, and you're going to learn a lot about that today. And we'll talk about other resources you can go to learn even more for our patients that just love to know everything. So we're going to start by sharing screens so I can bring up my presentation. And we know you guys are on your lunch break, so we want to be very consistent with our time. So we're going to try to keep it to 20 minutes so you still have time to eat, and hopefully you're all having a wonderful, yummy little lunch at your desk and learn something. So we're going to talk about these new technologies and treatments for ocular surface disease as of now. Some of the big things to remember is, what is ocular surface disease? I get that question a lot. Well, it describes anything that affects the lids, the conge, which is that loose connective tissue on the white of the eye, the tear film, and the cornea. That's that clear front structure. This can include everything with dry eye disease, meibomian gland dysfunction. Those are those little oil glands we watch for. Blepharitis, which is inflammation of the lids. Rosacea, facial as well as ocular, and just good old allergies, which we all know very well here in the Willamette Valley, and hopefully we're going to be extinguishing that very soon. It's coming down and we're getting in the good zone right now. So dry eyes, which a lot of us use as a short term for ocular surface disease, we know that we can make our normal tears most of the time, but sometimes over time, chronic inflammatory conditions can mess with that tear film, causing a dry, angry red eye coming through the door. And what is it? Well, we know that a lot of us are learning this over the last 4 years. Tech is one of the big things that's changing the makeup of that wonderful ocular surface. And we know that, they say 53% of adults and teens feel that screen time is causing some dry eye symptoms. So people are starting to get this. They even know that when they take breaks and look away breaks, some of them are even doing it without me even telling them to do it. But most of you guys know we talk about the 20-20-20 rule. Every 20 minutes of near activity that you're doing, take a 20-second look away break 20 feet away and then come back. But what I've added to that 20-20-20 rule is close and roll your eyes. And we want to be doing that frequently, even during this presentation, because we want to get those oil glands pumping. Because as we know, when you're on a digital device, your blink rates go from 20 times a minute down to 4, which is a 5-time shear cliff drop off of oil glands. And those glands are not happy about that, because if you don't use it, you lose it. So this is really important for us to start looking at the front of the eye. So that's why when we look at this picture and you look at this gorgeous, beautiful eye and the beautiful makeup and the long lustrous lashes, there's one telltale thing this person's not doing properly. And if you look at it long enough, I think you'll be able to figure it out. And I know, Amy, you want to tell them what's wrong with this picture?
Well, yes, the makeup on the
wet line,
the water line. Yes,
yeah,
water line.
There you go. We had some patients today already who had a lot of makeup, especially concealer, guys. Concealer can creep in there and it just clogs up all those wonderful 32 oil glands along the lid margin. So please don't do that. This is also called tight lining. You may have seen Kim Kardashian and other makeup artists touting this. Really bad, causes massive inflammation to the eye. And it can cause all these buggers. Aren't they beautiful? So these are all the nasty things living inside your lids and lashes. Those are some of the mites right in the center picture there. I feel like we're the Brady Bunch right now, but that center top picture is excrement from the mites that live up in there. And if you look off to the right, those cocooning little things, those are like little cocoons from the mite's excrement. And yes, you have mites. Everyone has them. 95% of the population have them. It's just how bad is it? And when we're scoring this and looking with the microscope, we can see it. We had one patient say, I went to my dermatologist. They said, I didn't have any mites. I go, well, the dermatologist doesn't have the microscope I have to see them. And then I took pictures and showed her, and she was very heavy all the way across. I go, yep, you have mites. But look at that lower bottom right picture, that red, inflamed, irritated lid. That's rosacea. That's mite excrement, and those are glands that are totally clogged, causing all sorts of inflammation. This is what we want to get squeaky clean. We want to start with a healthy ocular surface. So that's why I always say, work from the outside in, get those lids squeaky clean, and it's amazing all the wonderful stuff that clears up when we see that. The bottom middle picture there are showing how we take pictures of some of the glands deep in the lid structure. And you can see where there's in that circle, that red circle, where glands have receded and started to atrophy from these stupid little characters that live in our lids and lashes. So, you know, the other piece that you see on the lower left picture is, you know, extra makeup that didn't come off and is sitting in there festering as well. So making sure that we are using makeup that's approved. We all love beautycounter.com. It's a great website to see things that are safe and healthy to use, but we want to make sure that we are paying attention to what we put on our face. Here's another wonderful picture of Demodex. Again, all of those collarettes, the best way to see them is with a microscope. It's hard to see this with the naked eye. When you can see it with the naked eye, ooh la la, that's probably a stage 4, which is the worst it can possibly get. And they're fermenting a lot of these bad actors. They go up into the hair follicle, lay eggs, have sex. Yes, they do. And they ferment all of this wonderful garbage from their bellies, which are bacteria, staph in particular. And you can see those angry red vessels along the lids. That's ocular rosacea. That's about a 3 out of 4. This is somebody who needs some treatments, energy treatments, to get that under control, and also cleaning those lids. When we talk about a cycle of inflammation, ocular surface disease is all about inflammation. Let's go to the bottom at 6 o'clock where it says an inflamed lid margin. This increases all these nasty bad actors, and that clogs the oil glands. And then you go up to we're going clockwise now, and that decreases tear production, which also causes more inflammation because you're not flushing all that nasty stuff. It just sits and festers. Then that causes an overabundance of bacteria, and we can't make enough antibiotics in our natural tears to fend off these bad actors, which just causes this continuous circle of inflammation. And we're rubbing and itching our eyes. In fact, these nasty little critters make you feel like your eyes itch, which if you live in the Willamette Valley like we do, you think it's allergies, right? So we're throwing in allergy eye drops, which we may not need, and may be causing more harm than good. When I look at you under the microscope, this is what I see when I put that wonderful color dye in. I see desiccation everywhere. It looks like if someone took a meat tenderizer all the way across the cornea, and that cornea should look pristinely clean and clear. And when it's looking all pitted like this, that impacts how well you see. How can you see through a dirty windshield all day? Even looking at your, screens, a lot of people start squinting. They say, oh, I've got a lot of glare. I'm having a hard time seeing well at the end of my workday. This is what you're looking through, a very, very dirty, pitted, dry windshield. And we've got to repair it, or we can see scarring, which can cause long-term effects. So what are some of the over-the-counter things we can do? Well, first off, lid hygiene. We're big fans of that. One of the newer ones we've been using a lot lately is this hyperchlor spray. This is really great for our patients who don't want to do anything. They just want to get to bed and they just want to spritz, spritz, blink, blink, and go to sleep. And that can work really, really well for them. For our folks who wear eye makeup, we're big fans of the good old OcuSoft, which you can just literally suds it up and go with your eyes gently closed for 30 seconds, getting all your makeup off, doing the eyebrows as well. Wash that off, and then a good pH balanced facial cleanser is really the next logical step, as Gabby would be very well telling us. You want a 4.5 to 5.5 pH to keep that acid mantle intact so your skin doesn't get dry and scaly and cause all sorts of other inflammation. But you can't use that stuff around the eyes, including, as you know, Amy's showing, we don't want to use baby shampoo. Think of skull and crossbones with baby shampoo. Baby shampoo will strip those natural oil glands along the lids and cause a more harmful inflamed ocular surface. So throw that baby shampoo away. Don't use the soft soap in the shower. That's a pH of 11. Oh my gosh, no, no, no. And warm compresses are helpful. It's hard to do them. We did, as you can see, we've got the ZocuShield product too for those mighty, mighty people. We want to get rid of those little mite guys. A lot of times we'll prescribe that. Artificial tears. We're big fans of artificial tears over the counter that are oil-based, because that's what most of us are not making. 86% aren't making enough oil. So Refresh Omega-3, Sustain. There's another one that's a Bausch & Lomb product, and I'm having one of those blank out moments that's also good over the counter that are oil-based. Eye seals help with the goggles. You have to sleep in at night if we don't have good lid closure. We have poor structure function, the lower lid's open and dry you out something fierce. So if you wake up with really dry eyes in the morning, that's helpful. And blinking exercises. Yeah, we got to pump up those lids. We got to close and roll those eyes throughout the day. And I would do it right now. It feels marvelous. It just feels, that beautiful oil coming out. So I do it a lot when I'm online so that I keep those oil glands pumping. Because remember, we're not blinking enough. We got to keep blinking. The next thing that we will do is, if that's not working, the over-the-counter solutions, then our next step is going to some prescription eye drops like Restasis, which came out 20 years ago. And we now have two other follow-ups, Cequa and Xiidra. Both are used twice a day and they're preservative-free. We also have Regenerize, really kind of moving off the market because that comes from stem cells, which the FDA is highly regulating right now. So we're not really utilizing that. Autologous serum can be pulled from your own blood and spun down. And we love this wonderful new nasal spray called Tyrvaya. This actually goes and gets every part of the lacrimal system going, your lacrimal glands, your water towers, your goblet cells on the white of the eye, and those oil producers. So we're starting to use Tyrvaya quite a bit because we have some people who have issues with those prescription eye drops. Now, for some of you, we're not going to recommend any of those, and we're going to go straight to energy devices to get the oil producers working more effectively again. TempSure Envy is one of the most fabulous treatments. Amy knows this very well because Amy's our TempSure Envy specialist in the practice, and she does these treatments. Our patients love the treatments. They love coming to see Amy. They rest and relax and get restored, and this deep, wonderful heat just envelops your whole ocular surface and eyes, and the sinuses just open up. It feels fantastic. This brand new handpiece, the TempSure Envy handpiece, we helped in development, and it really gets in all the nooks and crannies and does a beautiful job of getting deep into the dermal structure, getting the water molecules heated up to 41 degrees Celsius, which is the magic number to get those oil glands pumping. And it helps improve that divots and wrinkles around the face and the eyes by improving collagen and elastin remodeling. So we get really nice structure function to the upper and lower lids. So we get you blinking more effectively again. And that helps get the meibomian out, which helps you see better and helps restore the ocular surface. It's fabulous. It does require some maintenance to it, but it is a wonderful way to get in there and get everything cooking and working effectively again. It's just one of our best ways that we can do on every patient, no matter their skin type, and year round. The other that we love, but works on the rosacea side of the inflammation, is IPL, or intense pulse light. It is not a laser. It is part of the whole visible spectrum. And this is where we have our lovely advanced laser esthetician, Gabby, who does all these wonderful treatments. And she does a beautiful job. This is actually Stevie. She's not here today. She's out of the office today, but this is Stevie having a temperature, a IPL treatment, which is fantastic, from our Cynosure Icon, which is really the Cadillac IPL on the market. It has specific abilities to look at your skin typing. So we get specific readings. It's the only one in the industry. And we looked at 12 different devices before we decided on this, because it is so impactful. And what would you say, Gabby, you're seeing now with results with rosacea? And
Well, ever since I got to harass Dr. Quibell up in Seattle, I've gotten some new fun settings. I love about halfway through treatments, people start telling me like, oh, I don't think about my eyes all day anymore. And so that's what, because not always can I visibly see the rosacea. Sometimes I get the fun of getting the facial rosacea, but a lot of the times it's stuff that I can't even see.
right, without the aid of the microscope, right? You got it. So that is a wonderful way of us mixing and blending a lot of these energies. We're also going to be bringing on another system called Tear Care that will aid in helping with evacuating the glands a little bit more. So we're very excited about that. That'll be coming soon. And we know that ocular rosacea is kind of the bane of a lot of our patients' problems. That's an inflammatory condition, which is what we've learned as, all of us that are Caucasians after 40, we see more of that rosy glow. If you go outside, especially this time of year, you're going to activate it and make it worse. And there's certain things that Gabby likes to go over with our patients to help keep the rosacea at bay. We can't cure it, but we can keep it under control. So that sometimes requires touch-up treatments to keep up with that. But the nice thing about IPL is it goes after pigment and vessels. So you get rid of some pigment spots that could be precancerous. So it reduces your cancer risk as well, your skin cancer risk. So doing these things has so many good benefits, and it kills the mites too, which we love. Regenerize, again, going to be going off the market here very shortly. Autologous serum and PRP is something we're looking at heavily bringing on in the practice, being able to draw people's own blood, spin it down, and make their own PRP drops, also injecting it around the eyes so that we can get better structure function. So more to come through the year. Amniotic membranes are from our most severe patients who have extreme exposure keratitis, and it is part of the amniotic sac. And these are membranes that we place on the eye that totally restore the cornea back to normal health. Now, that needs to have follow-up, and we have other things we need to deal with to address the underlying cause of this. But for some patients, this is where we have to start just to get them stable enough to do the energy treatments. Hopefully, that's not any of you here today. But here's our BlephX. You can see the before, all the debris from the mites, and the after. A quick, easy, wonderful, and comfortable experience that we have that we're going to spotlight today. And this is what we're talking about. We start from the outside and work our way in. So we're going to show you right now and spotlight everyone. We're going to get an up close and personal picture here. I'm going to stop the share.
All I have to say is, Lindsay, I must get on your schedule for that BlephX because that freaks me out.
Oh my gosh, my face.
So Lindsay's
Oh my gosh, it's there.
Yeah. So you can see there's a handheld unit that she's using. It's, I always think it kind of looks like a very soft, easy little kind of Dremel going across the lash line, and it cleans it very, very well. And it's very comfortable. It tickles a little bit.
I know you'll see me flinch, but I promise I'm just ticklish.
Yeah. And it does a beautiful job of cleaning that lid line. So we get all of that biofilm out. There's an accumulation, even with folks who do a very, very good job of lid hygiene. They sometimes still have a problem here with, keeping up with it. And we have some folks where they just are so mite ridden that we have to do this once every 3 to 4 months for some folks. Most people usually once a year, once every 6 months is enough. Think of it very similarly to like when you go to the dentist and your dental hygienist is doing a dental cleaning. Let's say maybe you're a person who has more plaque, or let's say you have Sjogren's, which is an autoimmune condition that just dries out everything and causes a lot of gum issues. Same thing happens here. It dries out the surface and causes more mite activity. So some of our Sjogren's patients need to come in once every 4 months to have a debridement here with BlephX, and it does a beautiful job. So very, very comfortable, very, very soothing. In fact, we'll usually take before and after pictures so we can show patients, kind of like how the dentist does when we go in, they're looking for all of that, and then they do their cleaning, and then they go back in and double check to make sure they got all the spots perfectly. But we do have some patients who just have to come in at least every 6 months to keep on top of this. And for many of them, that's all they need. If they just keep up with their lid hygiene, their ocular surface is pristine, and we don't need to do anything else. This is a very, very easy thing to do. How you doing, Gabby?
It feels so. I do know, like, you can see me flinch because it's almost like that nerve endings, or it's like not even tickly, but it doesn't hurt. But no matter what, your eye kind of does that little flutter. That's always weird, but I know afterwards that it is that same feeling after getting a dental cleaning, just like how when you wipe your tongue across your teeth and it feels extra clean. You just feel like you have new eyeballs after BlephX.
Yeah. This can be a really great treatment to do after people have been wearing extensions to kind of clean out all the extra glue that might be left over. Because as we all know, I'm not a big extension fan. In fact, nobody in our practice wears extension for a reason, because we take pictures and gross everybody out with all the glues fermenting formaldehyde and all the mites. When you have those extra long lashes, it just acts as little condominium projects for the mites, which are regurgitating staph bacteria. And anytime you get a sty, it's because you have an increase in mite activity in your eyelids. And those guys they're not friendly, and they have no useful purpose. So we don't want them. We want to kick them to the curb. So this is a lovely way to get that all under control. Yeah, you
An
look
eviction notice.
eviction notice. I like that. Well, it looks like we have one question here, and then I'm going to move it on to Amy. Oh, hi, Terry. She says, would you please share the medical truths about each of these internet facts? 1, you don't need to wear any goggles for LED, red, blue, and infrared light therapy. That is correct. You do not need to wear goggles for that. If you should wear goggles, the barely tinted goggles that come with the machines are enough light protection, and LED light therapies improve dry eye conditions. Well, these are great questions. LED light therapy is an additional energy treatment that we're looking very closely at, because it can help with reducing photobiomodulation and improving cellular ATP and the mitochondria, helping reduce inflammation. So there are some studies going on here with LED, and we're looking at maybe incorporating that with some of the treatments. There's some of these at-home units, some are better than others, and we'll probably do a separate webinar on that down the road to get everybody up to speed on what's good and what's not. But the good news is they are safe, and in many cases, we don't want you having goggles on because it can help with some ocular inflammation. All right, one more. Be My Lady is on prime sale today. Thank you, Terry. Those Be My Lady steam heat eye masks you can get on Amazon. We're big fans because they help with warm compresses. We love to sleep in them. I love them. Thank you, Terry. We're going to be ordering some up because of you. I was thinking about that today. Today is Prime Day. So some of these things you can get on Amazon, which is great. Love it. Okay, we have a few more, and then we're going to go to prizes. Hey, Alex. Alex is saying, can you state the name of the spray to clean the lids? I use OcuSoft, but it would be helpful for my husband, a contact lens wearer. Love that. Okay. What we recommend is it's called Hypochlor, and you can get this on Amazon. It's made by the makers of OcuSoft, and it's around 12 to 15 bucks. And again, has a 2-year shelf life, which we do like this Hypochlor spray. There's many out there, but this is our favorite, called Hypochlor. Okay. And I think, well, we have one more and then we're gonna go. Boy, a lot of great questions. Hey, no worries, Claire. Great to see you. I thought so after you said that. Nice job. He'll like it. Alex will like that. Okay. All right. I think we got it. All right. So Amy, you're going to take it away. I'm going to get you off the, remove the spotlight on Gabby now. So
All right,
Amy,
so
you want to tell
sorry,
them what
Dr.
our
Foley.
prize is?
yeah, so today we're giving away a bottle of the OcuSoft. We're giving away the OcuShield, and we are giving away a BlephX treatment. I really want to put my name in here, but I didn't. So let's see. Amber Liana wins the OcuSoft. Amber L, sorry. Constant H wins the OcuShield. Who wins the BlephX? Stacy H.
All right, Stacy, go you. That's awesome. That is a fantastic treatment. You're going to really love it. So just want to, that's good for the next 30 days. So just call in. You can talk to Amy or Stevie and they can get you scheduled for that. All right, all you wonderful people for tuning in. We really appreciate you. We want to be aware that you have your lunch still to finish. Thanks for tuning in. Next month, hey, Gabby, you want to tell them what next month is all about? Because you're going to be our star on that one.
So yeah, I might embarrass myself, but we're gonna do skincare for rosacea. So I thought, I'll just bring you guys with me and do my skincare routine. That just a nice basic one. We can always add stuff to it for different needs, but just kind of give you guys the basics, the core 4. So
Perfect,
I'll
perfect.
bring you guys along for that, and you guys will hear way too much of my voice.
It's a lovely voice. We're
It is
thrilled
a
to have
lovely
you.
voice.
Well, and that's important, guys, because, whatever we can do to keep the facial rosacea, and I can't talk today, rosacea under control helps you and your ocular surface. All of these things are all married together. And now we finally have it figured out. So please join us next month, the first Tuesday of the month at that 12:15 hour. We'll be getting out things on our social media about it. And we'll be able to, keep you all informed on the latest and greatest. And as things continue to improve and change, you guys will hear it right from us here at Foley Vision Center. Thanks so much for tuning in. Take care now.
Good day,
Bye,
guys.
guys.
Thank you.
Enjoy.